Good morning, everyone. It's a really pleasure for me to stay here in Athens. Wonderful, wonderful city. So let's start to talk about the autologous regenerative therapy. I think that at the end of these days, you're full of to hear about microenvironment, growth factors, all this stuff, but it's the most important thing of these days, so we have to talk about it and we have to do something together. So some practice, I think it's the most important part of this day because we can share our experience and our methodic approach to this kind of therapy. So the mission of the regenerative therapy. So when we talk about in a Seffihair Academy, I'm one of the scientific board of Seffihair Academy, we talk about the power of simplicity. So we delivered, my professor Alessandro Gennai is a creator of the Seffihair, and the power of simplicity is our first target. So to create something that every kind of physician can use, and it's a regenerative therapy to you, because before of 2020, this kind of procedure was only for surgeon. And a lot of physicians now, even, they are afraid to use this kind of technique. But now, today, we will see together, maybe all of you or most of you just using this kind of therapy, we can see how simple it is to apply and simple is the technique. And another important characteristics of this medical device, it's that it is obviously simple, safe, effective, but standardized. So we can standardize our harvest. So in order to restore the volume lost with ages, autologous regenerative aesthetic medicine, it leverages the power of stromal vascular fraction. Today we know the importance of this kind of tissue that we want to prelevate of our patients, and what we have inside. We have inside our stromal vascular fraction, mesenchymal, adipose, derived stem cells, growth factors, and exosomes. Autologous exosome. This is a very important point because we know how in aesthetic medicine, for sure, the concept of exosome is increasing during the last years. But we know even how many discussions are about the use of the exosome, because we know we can find on the market everything. Exosome, animal, vegetable, derived exosome, synthetic exosome, but this is the only exosome that we can use. It's legal to use. Because you know the problem that we have using exosome, animal-derived or vegetable-derived stem cells, because we cannot know what we have inside billion, trillion of exosomes that we are injecting. We know that exosome, it's a wonderful kind of delivering message between our cells. That's why the philosophy, it's very nice to believe that this kind of nanovesicle can deliver a message. But what kind of message they have inside? We don't know. But we know what we have here. We have our exosome, autologous exosome. That's why the implantation of this kind of exosome in the scalp can improve the communication of the cells. And then, until now, with Alan, we see how important is, in the recent even publication, the microenvironment of this kind of hair disease. So the goal of the regenerative medicine is it's not to restore the volume, for sure, improves the quality of the skin. So Seffi is not merely a fat graft, but it's a tissue graft. In the adipose tissues, obviously, we have adipocytes that can give us volume. That's why we use Seffi technique even for the face, for the autologous filler and regenerative therapy for the face. But we have all the stromal vascular fraction, that it's richer in adipocyte-derived stem cells. and all the cells that we need to create the regeneration. We don't need to create a volume. We want to regeneration. But for one exception. Then in the afternoon, we talk about the combination of regenerative therapy and transplant, fluid transplant. How important is, even in some selected cases, to use the whole tissues. Then after we talk about it. So we know the characteristics of mesenchymal cells. So the capability of differentiation in adult mesenchymal cells, like adipocytes, chondrocytes, osteocytes. Then we have the capability to produce collagen, glycosaminoglycan by fibroblastic cells. The capacity of homing, where the tissues need to be repaired. And what about the growth factor? Just before, we saw the importance of all these growth factors: vascular endothelial growth factor, fibroblastic growth factors, platelet-derived growth factor, TGF-beta, HGF, so hepatocyte growth factors, and EGF. But then after, we see how important is this kind of growth factors in the hair disease. What about the hexasome? We talk about the hexasome nanovesicles derived from multivesicular endosomes and secreted by the cells for the communication. If we use, as I told you before, animal or derived stem cells, we know that inside we can find even a microRNA. MicroRNA can deliver disease, virus transmissions, or, for example, from the vegetable-derived exosome, we can have a lot of transmembrane protein that can lead us allergic reaction. This exosome is autologous, so they are safe and we can inject it without any problem. We published interesting study. We demonstrate that in the tissue prepared with the Seffi technique, we have autologous exosome 24-25% more than compared to other procedure, because we don't have any manipulation of the tissue. So starting from when the Seffihair concept came from, it came from the Seffi technique. The superficial enhanced fluid fact injection was published in 2015-2016, started from a simple concept. Before, the tissue was extracted from a largest cannula, and then we perform a smaller cannula to selected with the micro holes in the cannulas, exactly the right tissue at the right concentration in the right size. We don't have to we don't need to purify these tissues. We don't need to manipulating this tissue with the filters. We just to emulsificate the tissue to decrease the thickness of the tissues, and then we can implant, as we can see, after even when using the Sef filler, in a different layer of tissue. So through the Seffi system, we just have a small cluster, and we don't need to cut or reduce it. So we have a lot of published study about our technique, and we proved that our cell had the capacity to differentiate towards tissues of mesenchymal lineages. So as we can see, without mechanical manipulation, we can obtain at time zero about 250,000 viable cells. And after 72 hours, we can arrive until 3 million viable cells. With manipulation, with other devices, we start from 15,000 viable cells, and after 72 hours, we have 14,000, so a little decreasing. As I told you before, until 2020, the technique was only surgical, but after the 2020, Sef filler became medical. What advantages this guide has? making autologous regenerative therapies simple, standardized, because this kind of guide, it doesn't require any surgical skills from the physician. Allows to harvest the adipose tissue in a standardized, easy, effective, and safe way. So let's talk about the cannula. The guide allows the Seffi cannula. Seffi cannula have micro holes, 0.8 millimeters holes, that selected micro clusters of tissues to penetrate maximum 15 millimeters and by 15 millimeters away from the blade. What that means? That means that when we penetrate after a little hole in the skin, I can prevent any risk to inject the cannula deeper. If I take my cannula like this and I try to inject, I cannot have any problem because the guide stopped me, no more than 15 millimeters. Once the guide is misrotated, this brings the guide to a depth 15 millimeters. And this guarantees the maximum safety and in deeply, but not only the safety, because as we can see, by harvesting of adipose tissues at 15 millimeters, close to the dermis, is the layer richer in stromal vascular fractions, adipose-derived stem cells, growth factors, and exosomes. That's why we created our kit, Autologous Regenerative Aesthetic Medicine Kit. Only one and disposable. I want to show you a video, maybe faster, because after we have the practical parts and we can see together all these passages, and maybe if someone wants to try with us, we can perform together the technique. First of all, we start to prepare our anesthetic solution. I stop it because it's a nice slide to focus on about the anesthetic solution. What I recommend, I use almost ever the 40 milliliters. It's perfect for the first treatment, but it's perfect amount to have anesthetic largest area, so I can move my cannula in a different way. So if I have any problem to harvesting adipose tissue, I can move a little bit more because I have more volume of anesthetic solution. 40 milliliters of solution, what is the composition? 10 ml of lidocaine, 30 ml of saline solution, and 0.4 milligrams of adrenaline 1 milligram milliliters concentration. How we inject our anesthetic solution? In the same way after we have the harvesting of the tissue. So we use the same cannula and we use the same guide. This is all the preparation that we have. And this is the kit. The kit is only in one. We have just sterile globes it's a part of, but we have all sterile inside, and all you need is inside. Just an anesthetic solution, it's not included in the kit, obviously, and you have to prepare apart. As you can see, we have 4 syringes, 2 different kinds. The white one, it's the VAC-lock syringe. It's a syringe that can allow to perform the harvested tissue. And the blue one, that 3-syringe blue one, for store our tissue, to wash it, and to leave vertically for to depositing of the washing tissues and to create our tissue to inject. So we prepare with adhesive drape for harvesting area. We can use a trochanteric area, abdomen too, that is most more useful area of the body. We do a little pomfus with our anesthetic solution. This is maybe the most tricky part, because with this needle we have to enlarge a little bit the hole to guarantee the injection of the of the cannula. Then we proceed to assembling of the guide and the cannula. We know that the guide has that hole that can specifically for our cannula. And then we have the latch syringe in the guide with vac lock writing it's upwards. But then we can see together immediately how that it works in practice. As you can see, we injected with the cannula and we're rotating, and we are in the perfect plane, 15 millimeters depth, and the cannula it's on the skin. And then we can start at the administration of anesthetic solution. We have to distribute more homogeneously as possible our anesthetic solution that can guarantee that the harvesting phase was perfect for our patients and without any discomfort. So with the same syringe, the vac-lock syringe, and our guide, we start the harvesting phase. The vac-lock it's upwards. We block the syringe in the guides, and the same procedures of the injection of an anesthetic solution, we start our procedure. We rotating the same. The blade adheres to the skin, as I told you, and then we have to put the syringe in suction mode. So lock the plunger rotating. It's very, very easy. And then we start holding the guide, we start the harvesting phase. Okay, we obtain our tissues. The fat transfer, we have a fat transfer inside of the kit, so we can transfer in our blue syringe, the blue reservoir syringe. Then we wash with a saline solution. The harvesting tissues, it's almost 5-6 milliliters. Then we can wash with the other 2-3 milliliters. We arrive at 10, and we place it in the slot and leave it there. And we repeat the harvesting procedures. Then we obtain our product. We chop the washing solution. We remove it. And then we are ready to use our tissues. So, as I told you before, Seffihair, it's a system. It's a system that we can use in a different area in medicine. As my colleague talked before, we can use in gynecology, in orthopedics, Seffihair, so in hair disease, dermatological problem too, and Seffihair for the regenerative therapy for the face and anti-aging effect. Just a few words about it, about the Seffihair technique. This is what happens to our tissues during the aging process. This is what happens to deep fat compartments. We can see how the structures changes. This is what a superficial fat compartments changing during the aging. And even the skin is changing. That's why with our TAR therapy, we can act on a different level. It depends on the fluidity of the tissue. And this is our fluidity chart, and we can use for injecting our tissue in a different layer of the skin. If we want to restore the volume, we have to go on the right side, on the microfat, on the biggest cluster. If we want to regenerate our skin, we have to go on the left part with nanofat and super nanofat. How we arrived at this concentration? Simply just emulsifying within the syringes. But let's talk about the regenerative medicine in the therapy of androgenetic alopecia and hair disease. What's the aim of this therapy to improve the microenvironment of the scalp. This concept is the main concept of this kind of therapy. The roles of these growth factors in the stimulation of follicle cycles are, as my colleague talked before, the importance of the vascularization with the vascular endothelial growth factor, the insulin growth factors, the beta-FGF growth factors, the KGF growth factors, and the AGF growth factors for the even collagen and elastin production that we need in the microenvironment. We know how androgenetic alopecia affects more than 70% of men and more than 40% of women in many ethnic groups. The fundamental is the diagnosis. Just a few words about what we have to see in which are the trichoscopic signs. We have the major trichoscopic features for androgenetic alopecia is, for sure, hair shaft diameters diversity, as we call anisotrichia. It's a variability in hair shaft thickness, more than 20% in males and more than 20% in female. This is reflecting follicular miniaturization, considered the hallmark of androgenetic alopecia. Increasing the vellus hair percentage, so the presence of short, thin, miniaturized hairs resulting from androgen-mediated follicular regression. Brown pelipillar sign, we can find it for sure. It's surrounding emerging hair shafts associated with perifollicular inflammation. And then for sure, reduce number of multi-hair follicle unit, because we find sometimes just a single hair, single follicle. Additional trichoscopic findings that we can find in for androgenetic alopecia, it's more rare, but we can find some yellow dots, white peripillar signs, and scalp honeycomb pigmentation. That is the characteristics of very severe cases of alopecia. As my colleague talked before, the different hair loss pattern with different scale, the Norwood-Hamilton scale classification for male and Ludwig classification for the female. As we told before, the cause is often multifactorial, so the stress, lack of micro or macronutrients, incorrect lifestyles, but even the synergistic of two molecules that damage the hair bulb, dihydrotestosterone and prostaglandin D2. But what we can find in an androgenetic scalp, androgenetic follicle, sometimes we have the marker of stem cells, the marker KR35+ positive. What does it mean? It means that our staminal cells is working yet. That's why the importance of regenerative therapy in this kind of disease is increasing. So the regenerative therapy is only the one of therapy that we can use for this kind of disease, because we know we are in front of a multifactorial disease. We cannot pretend to treat a multifactorial disease with just a single treatment and a single technique, because we have to approach with a multi-layer technique and a multi-kind of different technique. For example, not only the PRP, then after in the afternoon, maybe we can talk about the combination of Seffihair with the PRP, but the combination is even with, for example, injectable medical device like polydesoxyribonucleotides. Then it's in the latest years, it's very important because they are inside the philosophy of regenerative medicine, because we know how polydesoxyribonucleotide can act by stimulating the adenosine 2A receptors. What? To produce what? To decrease the production of pro-inflammatory cytokines. Even they can act on adipocyte cells to promote the adipogenic effects. But even to create the salvage pathway, they interact in the salvage pathway when we have a damage in our skin, polynucleotides can help to repair it. That's why it's a very important, the combination of all these techniques. We have to open in mind of this kind of communication, and when we have one patient, we have to create a protocol, and we don't have to leave our patients alone. We have to create during a year a protocol. Our patients know that has to come for a protocol of PDRM with associated carboxytherapy, 2 times per year, Seffihair, PRP each month for 3-4 sections. Our patient can be instructed about what we have for fight this kind of disease. And they have to know that it's not just a single treatment to resolve this kind of problem. So, as I told you before, it's possible to transfer the cells of the stromal vascular fractions in the liquid portion of the tissues. So we start with selecting the tissues with the guide, as we saw before, emulsification, so mechanical digestion of the tissues, about 20-30 passages between the syringes. Then we put in the test tube that you can find in the kit of Seffihair. And then we start the centrifugation, 10 minutes, 3,500 RPM. By centrifuging, we're transferring the liquid portion, the stromal vascular fraction, after 10 minutes in the liquid portion. And then we have inside the kit the long needle that can permit us to aspirate only the liquid portion. And then we start the injection. We can inject with multi-injection that you can find in the kit one, or you can even use a single needle. Sometimes I prefer to use a single needle because I can regulate it exactly the depth of the needle. If I want to use, as my colleague told before, if I have about the thickness of the scalp, I can decide to use 13 millimeters needles or 4 millimeters needle perpendicularly. That's why it's not a standardized protocol, the injection phase. I recommend to study our patient, to study the scalp and decide how to inject it. You can find the quick guide inside with the old barcode that you can find. And then what we recommend, so it depends. We recommend 2 to 4 treatments per year for sure. At the beginning, we recommend not less than 2 or 3 treatments per year. And then during our treatments, we can decrease year per year, depends on the progressive results of our patient. Now we can start to analyze the association of our regenerative therapy to other therapies due to obtain a perfect synergistic action for cure our hair disease. For example, the first one is with the surgical treatments like a hair transplantation. This afternoon we have a short presentation about it, just for present you the different way to approach to patients that just made some transplant or prepare the scalp to receive a transplant. Our colleague Piero Tesauro is most expertise in FUE transplantation, has a lot of cases using regenerative therapy and the transplant regenerative therapy before to perform the transplant, about 3 months before, to prepare our scalp to receive. Then after, in the afternoon, we can see which are the best candidates patients to perform this combination technique. As we told you before, the cicatricial alopecia needs surgical treatment, but we can add our regenerative therapy if we have not in acute grade of our disease. When it's regularizing, we don't have a lot of inflammation, we can act with regenerative medicine. We can act even injection the whole tissues, and then we proceed with the regenerative medicine. But we can even ask, but if I don't perform the regenerative therapy, what about just a normal transplant? It can be useful, for sure, but why not using an important therapy like this to prevent any problem with the transplant? We want to create the perfect microenvironment. We don't have any doubt for after the transplant that we don't have any bad effects and bad results. This is one of case of cicatricial alopecia, cases before 3 months of transplant with regenerative therapy and after with the transplant. With the courtesy for sure of my colleague Piero Tesauro. Then the regenerative therapy to cure the scalp and bulbs with a combination of carboxytherapy or injection of polydesoxyribonucleotides. This is my recent publication about the role of regenerative medicine and androgenetic alopecia treatments, an uncontrolled clinical trial that can lead us how important it is to perform, and combination, it's important to have the maximum of results. Carboxytherapy, I use carboxytherapy in all my cases, just because even to prepare the injection, for example, of medical device like polynucleotides or medical device with antioxidant, vitamins, biotin 2, I prepare the scalp injection by the carboxytherapy. I improve the circulation, and then the injection of my mesotherapy solution, it's more easy too. I perform carboxytherapy, sometimes even before to implant my regenerative medicine with Seffihair. I have 10 minutes to wait for the centrifugation, then I perform the carboxytherapy during that 10 minutes, and then after I proceed to inject my regenerative therapy. And here we have some clinical cases from my Professor Gennai and mine. But I think that in the afternoon we have a lot of clinical cases to show you. This is the study with polynucleotides, the recent publication. It's a mine study with Alessandro Gennai. Then we have the other kind of technique that we can combine. It's the trichobiolites. In one of the doctor of the Seffihair Academy, Dr. Domenico Piccolo, with the trichobiolites that combines mesotherapy, so a medical device, injectable, and LED therapy, 630 nanometers LED light. So he performed for first Seffihair and then continues for 4 to 6, even 8 treatments with the combination of mesotherapy and LED light. And he has a very amazing results. And then we have in the trichopath, it exists like a mechanical stimulation of the scalps. The same, we can combine it. We have our colleague, Dr. Melfa, that performed this kind of combination, as you can see even in his stunning cases. The trichopath, sometimes it's performed one section every 3-4 weeks, and almost 6 to 8 sections. So, just to resume, unique device for hair loss regenerative therapy, designed for aesthetic physician and dermatology, so every kind of physician can do, even without any surgical skill, can perform this kind of therapy. In the device, we have only one, except for the anesthetic solution that we have to prepare apart. Effective because we have demonstrated the viability and the quantity of the cells that we have inside our tissues. The selection plus emulsification plus centrifugation allow to transfer the stromal vascular fraction in the liquid portion, and then we can inject in all the scalp. And then I finished with the presentation of the Seffiline and Seffihair, and I think that we have some break now, and then we continue with practical parts, so we can together maybe share your experiences if you use the regenerative therapy. If someone wants to try it, we are here for you and for perform the practical parts together. Okay? Thank you very much for your attention.